We are here since 4 years, work in attending to Arab Health as a healthcare company and as a Al Sharq Hospital. We are every year trying to bring something new to the Arab Health, especially for the service for our patient. We are here getting some benefit from meeting some companies for medical equipment, especially for our expansion, which is coming in the coming few years. We have we will build another hospital, so we have to get updated for all the medical equipment coming to and collected here in the Arab Health. We are meeting the company representative to discuss with them whatever new technology and how we can bring it to our area, which is Fujairah Emirates. And it will help us to update all our equipment for the coming next years. For this year, we are giving more new service coming to Fujairah, like IVF center. And this is the first IVF center in Fujairah Emirates. So we are bringing the technology, new technology for this subject. So we will bring the service to Fujairah citizen and residents. We will be, as I told you, continuing for next year in Arab Health to prepare for our new hospital, which it will be again in Fujairah Emirates, about 55 kilometers from the first one. And we have our development for the hospital existing in Fujairah. We new division and the new centers excellence to come in Fujairah Hospital. So this is what we will try in the next year to put it for the people coming.
As you know, the Arab Health is one of the largest exhibition in the specialized in healthcare in the world. And Al Sharq Health Hospital is participating for the third year. And always we find there's a new technology, advanced technology. And as you know, many companies come from all over the world to offer what they have, like new services, new technology. And Al Sharq Hospital here also to promote itself, like for any new services. Like now we are promoting the IVF. We just started, so it's nice. We meet companies, and companies come over to meet us and showing us their what services, products they have, new products. And also we find many doctors and nurses come for looking for a job. So this is a really chance for Al Sharq Hospital to get staff, like medical staff in here, because they come from all over the world looking for a job.
Arab Health is one of the biggest signature events of the century. After RSNA in USA and ECR in Europe, most of the people have started coming towards Arab Health with a lot of expectations. There are more than 150 to 200 countries who participate, and there are also 5,000 or more stalls where people are exhibiting their latest technology and with the innovations that they have been working on. It's a very good pedestal for us to launch new products like what Trivitron has done. To give you a small synopsis about Trivitron, Trivitron is one of the largest medtech company in India with a 1,000 crore cap. And we are involved in two major pillars. One is the laboratory and the other one is the imaging segments.
The importance of medical tourism in Dubai is that it is here where East meets West. That is, we have got the culture of the East and the technology of the West. This place has got more than 70 hospitals which are accredited by JCI. So this just shows the quality that is being provided over here. The other part is that this place is approachable from all across the globe maybe that within 6 to 7 hours or 8 hours of the flight. So that's the reason this place is very attractive for medical tourism. The Tumbe hospitals are basically getting associated with the initiative of medical tourism. One is that we do executive health checks. Second, that we have got cosmetology as a branch and aesthetics as a branch, which is headed by a female plastic surgeon. That is where we take another chunk, which very few people have. The other things that we do over here is that we do have a very good plastic surgeons with us. So we do congenital anomalies over here. And the other part is infertility. So we are basically progressing towards it, and we are going to have our own infertility center in the future.
This is our first participation in the Arab Health. I'm very, very happy that we have, CAM and Alternative Health, and we are representing this in this conference. We've got very good response, and I'm very happy that we are part of this. We've been in Dubai for the last 5 years through our health clinic in DHCC. Last year, we opened one more clinic in JLT, and we're now opening our third clinic in Al Naida soon. So we will now have 3 clinics in Dubai, and then going forward, another one in Abu Dhabi soon. In the last 5 years, we have, built up a very strong base for homeopathy in Dubai. And I'm happy that in the last 2 years particularly, there's been a lot of influx of people coming in. We are among the largest flow of patients in Dubai Healthcare City, among all players over there, all the medical players. And it's just growing, and I'm looking forward to making sure that more and more people turn to homeopathy and alternative health.
Asthma is becoming a real epidemic, and it's worldwide. And in the United States, we have experienced an enormous increase, particularly since the 80s. So the estimate is that in the United States, we have about 6.5 million children with asthma. We have 22 million patients with asthma. And around the world, probably there are something like 200 million people that have this disease. So we are not sure why this is happening, but in all Western countries, there is a very rapid increase in asthma. Probably has something to do with the environment, pollution, and the changes in immunity, but it's becoming really an enormous problem. It's costing, in the United States, around the world, an enormous amount of money to take care of these patients. Now, one of the things that is probably increasing the incidence of asthma in the United States and the Western countries is obesity. We know that there is a link with obesity. Children that are above the 85th percentile for BMI, for body mass index, tend to have an increased risk to develop asthma. And so we have been doing a lot of studies in trying to understand why that happens. One in particular indicates that asthma is not that much linked to weight, but is linked to the metabolic abnormalities that are typical of obesity. So when the child becomes obese, one of the first things that happens is the triglycerides in the blood go up, and the child starts, and also the adults, become more resistant, the tissues become more resistant to the effect of insulin. So the pancreas produces more insulin. And both of those two things, high insulin in the blood and the increased triglycerides in the blood, are linked to asthma. So we have called that metabolic asthma, and that is a very scary concept, because a lot of children, even if they don't look like they're chubby, they start having changes in their lipid and glucose metabolism, and that is enough for them to increase pretty significantly their risk of developing asthma. So we have a new program that is called Be Well, has been active for a little bit more than a year. And that is a global program now, because, for example, it's being adopted in Saudi Arabia. Be Well is a comprehensive program that that includes not only the management of weight, but includes the management of all the comorbidities. So the patients come in a single appointment. They see a nutritionist, they see a general pediatrician, but they also see endocrinologists, pulmonologists, gastroenterologists to take care of all the things that go wrong when the child starts becoming obese. Unfortunately, obesity is a multi-system disease, affects the rest of the body. So affects anywhere from the brain to the muscles, to the pancreas, to the lungs, and so forth. And so we make sure that these children have a comprehensive approach, and not only we control their feeding habits, but also that we have psychologists that modify their behaviors. We have doctors that take care of all the aspects, and it's a highly successful comprehensive program. We have shown in pretty much a year that we are able to significantly decrease the body weight of these children, to keep it down, and maintain long-term healthier habits. For example, we have shown that children that participate to this program tend to watch TV much less, tend to be much more active, tend to do more sports, and so forth.
Linde is one of the largest gases companies in the world. It spans in more than 100 countries, and within healthcare sector, it's present in 60 countries. We have the pleasure to introduce our home healthcare and sleep profile and portfolio in United Arab Emirates. We have opened our first 9-bed sleep center, and that takes care of people suffering from sleep apnea, people who have had bariatric or who are going to have bariatric surgeries, who have respiratory problems, who have obesity, cardiac. This center is going to take care of them. We are opening a dedicated center for sleep, which is one of its kind in the market. Individual hospitals have 1 or 2 beds, but we do have 9 beds, and we do the E&M, we do the diagnostics, we do the study, we do the titration. So yes, we are unique in that way that we have a focus center which deals with that.
Our company is based here in Dubai, and it's concerned with feminine care product and healthcare products. Actually, now our product line is the women's sanitary pads, and after that we're going to introduce a new feminine product and to fill in the gaps of all the feminine care line. It's our first time to participate as Lenizer here in Arab Health 2015, and actually we select this exhibition because it's a very well-known exhibition here in Dubai and worldwide, and it's a really successful exhibition. It has been here 40 years, and every year it's getting improved and getting many exhibitors here and many entrants from outside and worldwide. So it's benefits for us to be here in Arab Health and to promote our product and our company as a Dubai-based company.
NMC Healthcare has been in the UAE for 40 years now. Interestingly enough, Arab Health is also celebrating its 40th anniversary. So both companies started together in 1975, and both of us are celebrating our 40th anniversaries. So NMC has been participating at Arab Health for more than a decade. You know, we think it's a great exhibition. It's probably the second biggest healthcare exhibition in the world. I think this year it might be the biggest. We've had very good crowds. This is a fantastic initiative by His Highness Sheikh Mohammed, and I think the entire Dubai government is behind this. Dubai Health Authority, Dubai Healthcare City, all of them are driving a number of initiatives. And not only the public sector, even the private sector is actively participating. NMC has partnered with the government in participating in a number of exhibitions. We are reaching out to a number of countries in the neighborhood, the wider GCC region. We're reaching out to Russia and the ex-CIS countries. We're reaching out to countries in Africa also, like Nigeria, Ghana, and Kenya. In fact, just here over the last couple of days, we've met a lot of people from these countries. We launched Brightpoint Royal Women's Hospital, which is a dedicated hospital for women's health. So we do obstetrics, gynecology, neonatology, assisted reproduction, and other allied services. On the other hand, in Dubai, we opened a hospital in Dubai Investments Park. This part of Dubai, there are about 250,000 people living in this part of Dubai. The closest hospital they had before we opened was half an hour away, either to the south or the north. They had to go to Jebel Ali or to Jumeirah. But now with our hospital opening there, all the residents have access to healthcare now, and we believe this is a great service to the community there. In addition to the new hospitals that we are opening, we have also launched a number of centers of excellence over the last year, and we are hoping to launch some more this year. So we've launched NMC Eye Care, which is a center of excellence for advanced eye surgery, NMC Orthocare for advanced spinal, bone, joint replacement, NMC Urocare for urology and andrology, NMC Surgery for minimally invasive surgeries, and NMC Heart Care for cardiac sciences.
Basically, Ann and Robert H. Lurie Children's Hospital is a 300-bed hospital that is specifically geared toward pediatrics in Chicago, Illinois, in the United States. And what we're looking to do here at Arab Health is really to form collaborative relationships with the different countries to have them basically send us some of their very complex patients that can't obtain the care that they need here in the Arab countries. So we have a lot of different programs that we feel can benefit children worldwide. We have robotic surgery specifically for children. We have cardiovascular surgery and cardiac abnormalities that basically can be repaired in the United States. We also have neurosurgical procedures and oncological procedures and treatments that can benefit children all over the world.
SGH is a regional player started in 1988 in Jeddah, Saudi Arabia, and is considered the largest private healthcare player in the Middle East. And we've started here in Dubai 4 years ago, the launch here in Dubai, in Barsha. And it's one of our largest and latest hospitals. It's a 400-bed hospital. And fortunate, we have won been certified by the medical tourism agencies, by TQA Medical Tourism Agency, and also by TEMOS, the German medical tourism, for our achievements here in Dubai.
Well, as you know, the American Hospital Dubai started in the late 1996, and the main vision of the board of directors was to establish an American standard of healthcare system in Dubai to provide an excellent care to the people of Dubai, the UAE, and the nearby countries. We followed the American standard, so we were the first hospital in the Middle East to obtain the Joint Commission International Accreditation, which is a quality measure of the healthcare that is provided to our patients. Over the years, we added significant scope of services to complement our original scope of services that we started in 1996. We are very happy and very proud to be a leader in providing a quality health care in the region. We started significant programs to be added to our scope of services, such as an excellent heart center that provides consultation, treatment, and management of different cardiac conditions, including emergency cardiac catheterization for people coming with acute heart attack, including an open heart surgery, cardiac surgery, and lung surgery.
Our company is actually based in Turkey, and we deal most in the hospitals and hospital equipment, and our specialty for the dialysis chairs and the hospital beds. And what's making difference is our company is the quality. We're exporting over 42 countries in the world, and especially dealing with the government. And we have lots of sales in US government and also Canada government too. And we deal with, if you see the range, how many product we're carrying in here, we basically place in the call our company name as Mona Medical is one place for the solution for the hospitals.
Inayati Home Healthcare is a home care company, Canadian owned and managed and operated, and has adopted the Accreditation Canada standards to deliver a high quality service here in the UAE, and will be expanding to the region as well. This is the first of its kind here in the region to establish a high quality service which is embracing technology from the early onset. Inayati means my care in the Arabic language. It has been established for the last 14 months, and over the past 6 months have delivered 10,000 hours of community services abroad. And what makes it unique here amongst the home care companies in the UAE, it has embraced technology. What I'm holding in my hand is a tablet, which for the first time nurses will be carrying tablets into the homes and documenting the medical records using a technology of EliaCare, a Canadian home care IT system, which you see here on the left-hand side. And it's a cloud-based technology which will allow us to support our nurses on the field from the supervisory offices, and will allow us to connect with physicians in the hospitals as well as abroad. I've been asked, how does Inayati contribute to the tourism industry? By having such connectivity, we are able to connect with physicians in countries of visiting countries, and provide data, health data, on their status here in Dubai while visiting Dubai and returning home. We're able to obtain any medication orders or adjust for any treatment plans by commuting with their physicians.
Amita Healthcare Solution, very affectionately called as AHS, is totally different from the rest of the healthcare providers. AHS believes in a totally integrated way of approaching the healthcare area. We are called as the integrators. When I say integrator, we bring in solutions to the end users. We bring in solutions to the owners. When I say solution, means suppose we have an issue on a critical care area, so we bundle it with the rest of the areas of giving a solution. If we're talking about healthcare IT, we give a total A to Z kind of a solution to them. You're talking about hospital planning or a medical equipment planning, we provide an A to Z kind of a solution. You're talking about neonatal care, A to Z solution. Talking about the laboratory and the clinical services, again A to Z solution. Not only that, we as a company, we also provide calibration services to the medical industry. Calibration services is important to calibrate the tools and equipments which are functioning on a day-to-day basis. So on a bundle, if you look together, their stream of activities, which is shown at the back, are the activities in which the Amita Healthcare Solution is focusing on. And as a company, we have been registering a growth of an average 19 to 21% year after year.
RAC Hospital in Ras Al Khaimah, we are promoting RAC as the new medical tourism destination. We have our own offices in 15 countries, and mainly the patients come from GCC and Africa. We get large number of patients from Nigeria, Ethiopia, Afghanistan, Iraq, Sudan, and Oman, Bahrain, Qatar. So these are the countries from where we are getting. We are targeting more and more countries in years to come. We are a center of excellence for cardiology, cardiac surgery, neurosurgeries, joint replacements. Recently, we have tied up with the best in joint replacement with Shelby Hospital from Ahmedabad. They are number one in the world. Dr. Vikram Shah, who is the founder and chairman of Shelby Hospital, has done more than 55,000 knee replacement surgeries. And he is the guy who does a knee replacement in 10 to 15 minutes as compared to 1.5 to 2 hours done in other places. So we are quite confident with these kind of top of the line and latest services being introduced in Ras Al Khaimah, we can attract a large number of patients. So what we are doing, we may not be the best in all areas, but what we do is we go to the best and bring them here.
Jordan, as you know, is the #1 medical tourism destination in the Middle East and in the MENA region, and it's from the top 10 in the world. This has been approved actually by the award that we won last year from IMTG. We won an award called Medical Tourism Destination of the Year 2014 for Jordan, for the initiative that we have been doing actually in supporting the Arab region, supporting the injuries during the Arab Spring. There are many factors that led Jordan to be the #1 in medical tourism. One of it is because we have very highly qualified staff, medical staff, healthcare providers, very high rate of physicians, very high rate of pharmacists and nurses compared to other countries in the region and in the States and in the UK. In addition to that, our doctors have specialized in UK, in the States, in Canada, so we have very highly qualified staff. The amount of expenditures on the healthcare in Jordan is around 9.7% of the total expenditures, which means that the country spends a lot of money on healthcare in Jordan, and they focus on local patients and international patients. Jordan is a very safe country. We don't have any problems with any countries around us. Most nationalities doesn't need a visa to come to Jordan, so it's easy. They can easily come to Jordan. We have a lot of patients that come from the Middle East and from the MENA region because we don't have a problem with the language, with the culture. It's all similar, and at the same time, Jordan is an attractive medical tourism destination because it's also an attractive tourism destination. A lot of people will come to the Dead Sea, will come to see Petra, will come to see other destinations in Jordan in addition to treatment. We also have a moderate weather. And now we'll talk about the healthcare in Jordan. We provide very high quality of healthcare at the same time at a very competitive price. So the patient would get high quality of medical service. They will get, they will be treated in a 5-star facility. Physicians would speak their language, different languages, and at the same time, they will get very high success rate, and we have very low infection rate. Length of stay is very short compared to other countries, and the patient would be satisfied for being treated in Jordan.
So Rex is a robotic exoskeleton that enables a disabled person to walk. It was developed 11 years ago by myself and my best friend. We both started the business because he was diagnosed with multiple sclerosis, MS. and we decided to build them a set of robotic legs to enable them to walk. And we have two devices. This is a rehab device, quickly adjustable between different users. It takes 3 minutes to adjust from 1.42 meters to 1.93 meters. And anybody with a mobility impairment can basically use REX so long as they have a sufficient range of motion to allow them to walk.
This is predominantly for the rehabilitation.
This one here is for rehabilitation. We also have a mobility device, a personal device. It also allows users to go up stairs and slopes.
So what is the cost like? Is it affordable for the general users?
It's $200,000 list price just now, but when you compare that to the cost of the secondary complications of sitting in a wheelchair, the medical complications, it's a comparative price and works out economical.
Do you got any suppliers in the UAE?
Well, we're here right now looking for distributors and customers.
Any tie-up with the hospitals or government authorities?
We've been talking to an awful lot of people since we've been here. It's very exciting to be here at Arab Health and met a lot of interesting people.
The UAE is currently making major efforts to develop medical tourism to the region. This is being driven largely by Dubai at the moment, but it involves many of the other major facilities in the Northern Emirates, such as Sharjah and Ras Al Khaimah. Now, at the moment, the medical tourism is focused mainly on two areas. That is wellness. So that's health screening of all sorts, and aesthetic medicine, because the practice of aesthetic medicine is a world-class standard here in the UAE. However, as time goes on, the healthcare tourism must focus on more acute medicine. Treatment of, for instance, cardiac conditions, neurosciences, rehabilitation, and more complex malignancies. And this is where the larger facilities and the complex facilities, such as the University Hospital Sharjah, will play a role in the future of medical tourism, simply because they have the expertise in terms of the doctors, the nurses, but also the infrastructure in terms of equipment, intensive care units, complex imaging and laboratory services.